What if I told you that when your doctor diagnosed you with a mental health condition and prescribed you that very first medication, there were probably 50 other things he should have assessed for and treated before writing that script? You'd likely be worried that he had missed something and that maybe you didn't need to be on the medication in the first place, or maybe you could just be on a lower dose. Well, that's what we're going to be discussing today. We're going to be talking about the poorly appreciated field of functional psychiatry, that is root cause psychiatry, with the leading expert in this space, Dr. James Greenblatt. Enjoy. I'm delighted to welcome Dr. James Greenblatt to our podcast today. He is the founder of Psychiatry Redefined, but from my perspective, he's so much more than that. He's the psychiatrist who really introduced me to functional medicine, and not just me, many other people. And I would say he's the leading voice in functional psychiatry. And he's the author of several books, which I think are great. We've got Finally Focused, the depression book, and also the antidepressant withdrawal guide. And I'm so happy that he's here because not only has he trained me and my wife a few years ago, he's actually trained one of our staff, Giselle Rosa, who works with us, and I would say probably thousands of others. And the reason I wanted to bring him on the podcast is because there is a problem at the moment where many people will go and they'll see their doctors for mental health concerns, and they really typically only get two options presented to them. One is medication management, so an option of different meds, and another is psychotherapy. But there is so much more to offer than that. And while I think we do a good job, kind of a better job in psychiatry at looking at stresses that come from, contextual things in our life, like breakups and things like that, I think what's often missed are the medical reasons that make people feel like they have depression and anxiety. And there's about a million different things in there. And I always knew this, and I always read, there was problems with like hormones and vitamin deficiencies and all of that, but I got lost. But what Dr. Greenblatt has done is he's developed protocols for all of these things, and he's put them in his books. So there's protocols for how to treat depression and ADHD, and he's spent his career really studying all of these medical and nutritional problems that can lead people to get diagnosed with things like ADHD and depression. And he's laid it out for clinicians like me and others to follow to help people, so we can, one, avoid medications if possible, or use them at the lowest doses. And so that's what we're going to be talking about today. And Dr. James Greenblatt, thank you so much for giving me your time on a Saturday morning to speak with my audience.
My pleasure. I'm so pleased to be with you, Joseph, and help continue to educate clinicians.
Mm-hmm. So maybe my question for you is, what do you wish people knew about treatment for mental health? From your vantage point now, now that you've seen all these options out there, what do you wish the public really knew about this?
Well, there's so many answers, but the one that just kind of comes to the top right now would be to instill this feeling of hopefulness. Because I think our current model, where we're just throwing symptomatic-based, Band-Aids, medications primarily, some people get better, many don't, and those that don't get better, there's no path to feeling hopeful. It's just a path towards more medications, typically. So I think the most important thing I've learned over many, many years is that regardless of the diagnosis, regardless of the past treatment, that looking at the individual and this kind of integrative and functional approach, there's just hope to really support recovery from mental illness.
Now, for people out there who may not have heard the terms functional and integrative before, what do they mean?
Yeah, really great question, because they probably mean different things to different people. The way I would describe them is integrative is kind of the softer treatment approaches like mindfulness and yoga and lifestyle and sleep hygiene. And maybe don't forget to eat your broccoli. And that not only the information is available, but our academic institutions, Harvard and Stanford have programs on mindfulness. And you can get a fellowship now. You can get 2 years of training in lifestyle medicine. And that's great. But for too many of our psychiatric patients that you and I are seeing, those struggling with major mental illness, that is not sufficient to turn the path around. And that's where functional medicine. So the functional medicine is the root cause. It's looking at objective laboratory tests. Could be a genetic cheek swab. It could be looking at a vitamin B12 level. But these objective tests that can help support a traditional approach, meaning meds and therapy, the integrative approach. But to me, it's a foundational approach, looking at root cause.
Mm-hmm. And when you survey what's happening in the treatment of mental health across the United States at the moment, what do you think are the biggest problems out there that are keeping people unwell?
I mean, it's a really important question because there's certainly a groundswell of interest in integrative and functional medicine, and that's great, and you're helping to educate people. But there's also this kind of entrenchment in pharmacology as the only treatment option. So I think the hardest thing for me to watch is my colleagues. If the first medicine doesn't work, just try a second, and then the third and the fourth. And I think the average now are people coming out of hospitals have 5 psychotropic medications. And I think it's that kind of refusal to look deeper at the problem rather than just throw a medication that I think is part of the reason that we're so entrenched in this kind of chronic situation of too many people not getting better.
Mm-hmm. Now, I think it will be really helpful to actually hear your story because I'm curious about it. I have heard some of it before, but I would like to know, how did you end up in a position where you're now essentially what I would say is the leading figure in functional psychiatry, at least that I know of? Could you walk us through when that started to happen in your career? How did you stumble into psychiatry? What was your perspective on it at the beginning? And what made you take a turn to dedicate your career to really fleshing out this approach where people could, try and treat these conditions with, as little medications as possible? I'd love to understand that a bit more.
Sure. I mean, it goes back, not quite 100 years, but many years in college where I was writing papers, on nutrition and schizophrenia. At that time, it was called orthomolecular medicine, and the first double-blind placebo-controlled trials in all of psychiatry was on vitamin B3 in Canada, B3 and schizophrenia. So before, I knew I wanted to be a physician. I had no thoughts of psychiatry, but I was studying nutrition and brain science. I was actually involved in yoga and other kind of alternative treatments at the time. And so I went to medical school, teaching medical students yoga and relaxation techniques. And then 9 years later, I came out as a psychopharmacologist who, haven't, been in a yoga studio or exercised in 5 years. So as a child psychiatrist, treating ADHD, medication was the only option. And quickly I realized that many kids weren't getting better, side effects. And I just kind of got back to the roots of why I wanted to study medicine. That was understanding nutrition and brain function. So that was in, the 90s. And I think the reason I've been able to sustain my interest and maybe respect for my colleagues is I've always kept one foot in traditional psychiatry. I've ran inpatient units, and I've been able to do that by focusing on eating disorders. So patients for 25 years, I ran eating disorder hospitals, individuals with malnutrition as the core problem driving their illness. So I could talk about vitamin and mineral deficiencies at grand rounds and to my colleagues 20 years ago for anorexia nervosa, because that was a main problem. And so, I think too many of our colleagues have either, put their camp or focus in just medications, and others have thrown away the prescription pad and just supplements. And I think I've just been able to bridge both worlds. There's a value in all of our tools, and it's just been gratifying to see the outcomes because people can get better.
Maybe you could speak a little bit, provide a few examples of just patients that you've helped using this approach, just some brief vignettes of cases you've seen turn around with what would seem like, I guess, to the audience member who may not be familiar with functional medicine as, unusual approaches, certainly not traditional approaches to treating things, just so people can get a sense of what's possible with these interventions.
Sure. I mean, the list is long, but let's just take, treatment refractory depression, right? This subgroup of patients that don't get better with any traditional approach. Just the name, think about it. We're blaming the patients. They have refractory depression, not our ability to help them. So we can talk about many individuals who don't get better with medications. We do a cheek swab and look at a genetic marker for folate metabolism, so an MTHFR marker that tells us that they don't metabolize folate well, and you need folate for all the neurotransmitters, as you know. So it doesn't mean that genetic vulnerability causes depression, but that genetic vulnerability for someone who might be eating a poor diet and experiencing stress or trauma, that now genetic vulnerability becomes a problem, and they're not getting better. And just by looking at that test and providing a folate supplement, medications all of a sudden work better. And so many cases of what we call, and this is hospital work, people that had to come into a hospital because their depression didn't get better. Mm-hmm. And then there are lots of really simple interventions by people misunderstanding vitamin B12 levels. Vitamin B12 is associated with every major psychiatric illness. Fatigue and depression is common. But we've also seen psychosis and mania. So our current lab slips look at a B12 level of 200, and the lab slip says it's normal. But for 30 years, colleagues of mine, we know it's not normal. And a recent paper came out 2 weeks ago that demonstrated that. So that's exciting. So just giving someone a B12 supplement, again, who didn't get better with traditional factors, who had those low levels, completely turned around a major mental illness. Mm-hmm. So there are 200, 300 biomarkers that we might look at in helping a patient. And not every patient is the same biomarkers, and some might not have any that are significant, but there's just so many individuals that do have these objective tests that are just easy to treat, that just support either the recovery or, in your work, helping someone taper off a medicine.
Mm-hmm. One of the I don't know anyone that talks more about lithium orotate than you, but it was something that I've found to be incredible. I try all of these things, so I also try them with my patients. So lithium orotate, I don't know how you would describe it, but my first introduction to it was really in the context of your ADHD book for people who are having some irritability as well. And that's me. I definitely would identify as someone that kind of runs on the more restless and irritable side. And just taking small amounts of lithium orotate, it was almost incredible how effective that was. Now, I don't know if it's, there was some lithium deficiency, or maybe even just at that low level of lithium, it has this, quite nice calming effect, but it is a very safe intervention. And so that was also another thing that I thought was really interesting about what you do, is that you're able to use things like lithium orotate. And I don't know if you look at this way, but I do in some ways, almost like safer drug options than other things out there that can actually be just as powerful and be much safer. I'd love to get your perspective on that.
Yeah, well, lithium, as you know, I could go on for hours. It is a medicine that we might use in psychiatry that has side effects. But it's a mineral that's in the Earth's crust, and we use it in technology. We've heard about lithium batteries, and it's in airplanes and cell phones. But it's also a nutritional supplement. I learned about it in college from Jonathan Wright, and been studying it and reading it and using it in my practice for 40 years. And at these tiny doses, the amount that many people might get in their diet or their water supply can have profound effects on individuals. I actually believe that there are some people that have a higher need for nutritional lithium, just like we know people have a higher need for vitamin D or B vitamins based on their genetics. And as you described, these 1 to 2 to 5 milligrams, which again, for some people, it's in the amount in their diet or their water supply, can have profound effects on the brain. And the research, as you know, has demonstrated just undisputable anti-suicide properties, anti-dementia properties. And in a clinical practice, what I use it most is what you described, is this symptom of irritability, which cuts across every diagnosis, as well as so many other kind of psychological symptoms that we address in our practices.
I mean, it's so powerful that when I was taking it, I kind of go off and on depending on my irritability. My wife can tell, because I'll finish a long day of work, and if I'm sitting down on the couch with her, she'll say, you just seem a lot more grounded. You seem a lot more present. Whereas if I've had a hard day, like I might be up kind of pacing around, I might be sort of short with her, but it's she thinks it's been incredible. And it's working if the wife is noticing.
Absolutely. I've usually make a joke about a picture of a thank you note, that I've gotten more thank you notes from spouses and teachers and family members from these interventions with low dose lithium orotate.
I think it makes me more social as well. Like if I've had some that night and I go out to a bar or a dinner as well, I'm just more grounded. It was the one thing that I learned going through the fellowship program as well that really kind of knocked my socks off in terms of just how much of an effect such a small amount of lithium could have. I mean, it was crazy. Yeah.
Yeah, no, I mean, it's really important that we educate. To me, there's a kind of cosmic spiritual part of this, because it was one of the first element, in the formation of the universe, the Big Bang. There was lithium. And so, it is part of our history, our earth, and critical for brain function. And it varies based on where we live. So we know that, the amount in our food and water supply. And as I said, I'm just convinced some individuals, based on their genetics, have just a higher need. And we can just support that need with micrograms of this mineral and see tremendous changes in mood.
Yeah. And I mean, it's the difference because, I mean, you talk about this in your book, but many people have seen this in their own lives. I mean, you can have a hyperactive, irritable kid, and the doctor goes, they have ADHD, and they don't really respond that well to the medications, but they stay on them anyway, and they're kind of on edge. And there's that path where they're essentially on stimulant medications, or you put them on small amounts of lithium, the amount that you would find in the groundwater in some places, and they're fine. I mean, they're much calmer. I mean, it has a huge impact on the trajectory of what happens to kids if they know about these things and if the parents know about them.
Yeah, I mean, I think that is a really important point, because some of our kids now that are being treated with multiple psychiatric medications where nobody is looking at a functional root cause approach, at 7 and 8, they're put on this trajectory, to use your word, of just being on medicines for long periods of time, potentially having significant metabolic side effects, and no one ever addressing these root causes.
Mm-hmm. And the thing that I see in my practice that's really quite sad is medication cascades. I see people several times a week, and they'll say things like, well, I was on ADHD meds when I was 8. I came off them when I was 12, and I went into a depression. And then I got put on Prozac, and they may never have needed that. Or they, get on ADHD medications and they got misdiagnosed with bipolar disorder, and then they ended up on a antipsychotic or a mood stabilizer, and it just kind of spirals. And before you know it, you have someone on 5 medications. And if you trace it back, the whole thing could have been averted with a root cause approach right at the start.
Absolutely. I mean, that's why we continue to do what we do. And I'm glad you're helping as well, because oftentimes really simple protocols could have made a huge difference. The other part that came up as you were talking is so many times we're seeing patients with symptoms of an illness that is caused by the medication. I mean, we see binge eating disorder on patients that are put on antipsychotics that cause them to increase appetite. Or we see people come in with a diagnosis of ADHD because they're on antipsychotics that cause inattention. And so they really don't have these underlying disorders. These are side effects from the medications.
So I want to get your perspective on this. I mean, you've practiced for most of your career. I mean, you've seen these amazing about turns when you do this root cause approach. Why isn't it done in traditional psychiatry? Why does someone need to come see, a specialist for this? What's your perspective on that?
There are lots of reasons. The first being that, so much of psychiatry is funded and the research based on pharmaceuticals. So that's kind of the training that our doctors are getting. And number 2, the insurance companies, a 10-minute med check works out better than the expense of these other tests. And then the reality is our patients, we all want the quick fix, right? If we have a headache, we want to take that pill for it to go away. If we're sad, we want to take that pill for it to go away. So our patients are looking for the quick fix, and our doctors have this theoretical quick and easy tool. So it's just this kind of perfect storm, if you will, of many factors that the easy way for treatment is medication management, and more medicines based on more drug development becomes the next path. And to do this work, as you know, takes time, and you have to relearn some of the things you learned in training. And there's just not enough doctors that are doing that work.
So another question to you, because there's more. I wonder if you've thought much about this, but I do, and I want your perspective. I mean, there's more to the way we practice psychiatry than just drug company funded research, and the I guess the way the insurance companies incentivize doctors to see people in shorter periods of time. I mean, we also have psychiatrists at the NIMH, the publicly funded docs who are meant to be doing research to advance public health. We've got academic leaders in all of our medical schools, but and these are supposedly, independent people, not linked to drug companies. And even in these settings, there seems to be very limited interest in root cause medicine for psychiatry and promoting these things, to the point where I almost feel like there's a skepticism about functional medicine, where people eye roll and they go, well, that's not really medicine, because if it was, the psychiatric leaders and such, these independent people would actually be taking it seriously. I mean, what's your perspective on what our independent psychiatric leaders, why they seem to not be interested in picking this up and leading the field towards a more root cause based approach?
I mean, I've been asking that question, Joseph, every day for many, many years. And I mean, there's anger and rage when I think about it, because these are very smart, brilliant, influential people. The only answer that I've come up with and I presented in some of my lecture is quoting an article from the Journal of the American Medical Association in the 80s, written by two doctors, called The Tomato Effect. And essentially they compared how for 200 years in this country, from 1600 to 1800, we wouldn't eat tomatoes because we thought they were nightshade, poisonous, right? Mm-hmm. Even though we knew they were eating them in Europe. And then somebody stood up in a square in Salem, New Jersey, ate a basket full of tomatoes. And then it was okay to use tomatoes in the States. So they just compared that model to the rejection of very simple interventions in medicine that are ignored. And so the punchline is nutritional interventions. Some of the work that I've done with eating disorders, anorexia, an intervention like zinc and omega-3s can turn some of these kids around, but it's too simple for our model. So just like we couldn't think of eating tomatoes for 200 years, I think culturally, medicine, it's very hard to think of these very simple nutritional interventions as something that could change the course of a major mental illness.
How do you feel about RFK Jr.? I know this is, if you're listening to this now, this is March 1st, 2025, and we just had the RFK Jr. and Trump's executive order to sort of investigate, start looking into more things like, overprescription of medications, not just in psychiatry, but in general. What's your perspective on all of this? Because, RFK, I know he's very into clean food and nutrition. How do you feel about what's happening politically with health at the moment in the U.S.?
Yeah, I mean, I certainly don't take political stands around health, but I think that, he's not a physician. He might, eat healthy and be, interested in kind of the health movement that you and I might want to be part of. But I just don't think someone with his knowledge base should be making decisions about healthcare.
Mm-hmm. Okay, fair enough. Another thing I wanted to touch on, which I think is really interesting about what you do, is it's not just looking at nutritional deficits. I mean, you find real medical problems going on with people. And I kind of, you talk about Clostridia infections and yeast infections. I was wondering if you could just speak to that, some of these silent medical problems that you find in your patients, which when treated, help turn things around.
Yeah, I mean, I think, in medical school, we learn lots of potential medical causes of psychiatric illness. And then when we get out in practice, we just learn that these are medication deficiencies. I mean, the list of things that can cause anxiety, from a hiatal hernia, to a thyroid, to a whole bunch of other medical complications, including cancer, that never is looked at by psychiatrists. I think they're all tragic if someone misses a hormone or a thyroid or, a hiatal hernia. But, what has been kind of hard for me to understand is missing some of these chronic infections, because particularly chronic Lyme and other tick-borne illnesses, because they can wreak havoc on the brain. We've seen cases of severe schizophrenia, suicide. Is a physician, colleague of mine whose son completed suicide and was found to just have tick-borne illness on autopsy in his brain that was undiagnosed and untreated. There are just so many paths to disrupting brain chemistry that are just ignored. And it is complicated, but there is a path to looking at these medical causes.
So I know for me, when I was going through training, I mean, I would come across articles about, vitamin D deficiencies, all of these medical problems that may cause issues. What I really appreciate about your work is that you have a framework. You kind of take all of these various things and you kind of walk people through it. I think you call it the zebra, and I know you trained me with the zebra, and I see it in your depression book. But I was wondering if you could just provide an overview of how you think about someone when they come into your office. Maybe use just depression as an example, and the way you're thinking through all of the different interventions that you want to try. If it is a person who's saying, "Hey, I want to treat this without medications," how do you look at that person and just and if you could just present your thinking around that?
Sure. I used the zebra with an extra E as a mnemonic, and I chose zebras because every zebra has a different stripe pattern. So I think the most important thing that I learn and relearn every day is every patient is unique. So we could talk about, 10, 30-year-old women with depression. And when they're sitting in the office, I'm not thinking one of a Prozac deficiency, and I'm not thinking of one medical problem. So I use the zebra, and just some of the T stands for, take care of yourself, sleep, sugar, and stress, and then hormones, and then exercise, and then zinc and trace minerals, looking at vitamins, looking at the gut, looking at amino acids. So there's just a very long list. And I can't sit across from a depressed person and know exactly what's going on without testing. So as you said in your introduction, I agree. I think mental health clinicians have done a pretty good job of looking at the individual, their story, their trauma, their past, their parents, their current life stresses. But we're not doing a great job looking at that individual as kind of a genetic biochemical being. So that's kind of the zebra approach. How can we look more closely and then, based on the testing results, kind of put together a more personalized approach?
Yeah. And just to expand on this a little bit, just because I know there's a lot of people listening to this who were first introduced to antidepressants by their family doctor, probably maybe with about 8 minutes of FaceTime. That's not that uncommon. But when you think about this, what Dr. Greenblatt's talking about, did they look at your hormones? Did they look at food sensitivities? Did they bring that up with you? Did they do any testing for minerals, things like zinc? Did they talk to you about fat intake, essential fatty acids, and digestion, and it goes on and on? Did they do testing for other problems, like gut problems as well, like Clostridia and yeast? I mean, there's so much more, and this is the point that I want people to really take away from this. That there's so much more than just being diagnosed with depression based on 5 out of 9 symptoms on a checklist that you filled out in the waiting room, and that's not proper mental health. That's not the care that anyone would want for a loved one with anxiety or depression. They would want a doctor to really take the time with them to look at root causes, because it really can be the difference between becoming dependent on a medication, which eventually turns on you later on, or just nipping it in the bud at the beginning. And that, to me, is the tragedy of what's going on these days, is that people are robbed of the opportunity to treat things at the root cause. And they're told that it's this is safe and effective because the FDA says so, based on a 3-month efficacy study. And you could probably tell it gets under my skin, but there's so much more that we could be doing to help patients.
Absolutely. I've started using the term, that your listeners can share with their doctors or colleagues, is just to remind the doctors that you have a neck, right? Your body is connected to your brain, and you want that assessed. That might be contributing to those symptoms. And there's still, this is a struggle that I've had. There still might be stresses and trauma. You're going through, a difficult relationship, but it doesn't mean there's not underlying genetic vulnerabilities or biological causes. So I know you do and I do. We still kind of respect the role of psychotherapy and support, but using that with some of these biological interventions, everything just works better.
Yeah. And it should be done in an order as well. I think it's would make sense to most people that you go through and you treat root causes, whether it's root causes, medical problems, or whether it's contextual stresses in the life where maybe someone needs support with relationships or work or grief. And that only after those things would you turn to a symptomatic treatment that has, and that there should be an order to these things. And there isn't right now. And I think that would be the biggest change that would revolutionize psychiatry, is just to do things in a simple order where it's, treat root causes first. And then after that, you can assume that it's genetic. And then you can say, well, we've done most things. Now we're going to rely on a medication to help this person function. And you do it from a place of knowing that other causes that are modifiable have been addressed.
Absolutely. There are some clinics, I have students that we work with that are in clinics where they're not allowed to order blood testing or vitamin D level. And I think, low vitamin D is one of the single greatest tragedies in our mental health system because it affects many major psychiatric illnesses. But they're in a mental health system, where they can't order these basic blood works that are covered by all insurances.
Yeah. So I want to shift gears because I want to make the most of our time together today. And I want to ask you about functional medicine for schizophrenia, because we have people who listen to us who are, they've got psychotic illness or schizoaffective, and them and their families, they're also wondering, what else are options for me? What else should I be looking at in terms of interventions? And I was wondering if you could speak to that. How do you look at patients with psychosis and mania?
Yeah, I think that that's kind of how I got started in this field, and it's called orthomolecular medicine. And it's a beautiful term coined by Linus Pauling, a Nobel Prize winner. Orthomolecular, the right molecule, and it's just making sure that we have the right molecules in the brain. And so it's an important question, complicated answer, because there are many, many variables. But the one thing that I've written about and I've seen in practice that I would do with any schizophrenic patient, and the literature is extensive, is gluten-free. And I'm not a lot of doctors in our field, everyone should be gluten-free, and that's not how I've ever practiced. But for psychosis and schizophrenia, the literature is impressive, and my clinical, patients. So I would do gluten-free regardless of testing. There's high rates of celiac and food sensitivities, but some have a unique sensitivity to gluten that's not celiac. But gluten-free would be kind of number one. And the other path is all the functional testing. There are a number of variables. The one that is not kind of in my routine test, but we do in autism and schizophrenia, is looking at what's called a folate receptor antibody, which is very important. And we've seen psychosis and other major mental illnesses reverse by looking at this marker, knowing that folate doesn't cross the blood-brain barrier well, and using folinic acid, a form of folate. So there are many, many paths to psychosis that we've discovered that's out there, but our only current treatment model is antipsychotics, which works for some, but not for all. And the side effect profile is pretty horrific.
I have a great anecdote for you. I would say probably 3/4 of the staff in my clinic have, lived experience. These are people who have been on psychiatric medicines themselves and have tapered themselves off. And one of them, her name is Trudy, and she was on antipsychotic medication for 20 years, started as a late teen. She cut out gluten and her symptoms went away. She tapered off antipsychotic, Lamictal, antidepressants. She tapered off everything. She's been stable for 5 years now and holds a caseload of nearly 50 patients in our practice and is just a rock star. And she was, at some point, she nearly was in a group home. I mean, that's how bad it got for her. And so I've seen, and this is not keto or anything. It was just removing gluten. That was the thing. And now when she has exposures, she knows because she has flares, and it's tightly linked to that. And so you have to see it to believe it sometimes, but it's incredible. Because I think people will hear that and they'll say, "Oh, gluten, what's the big deal? Everyone's eating it," but it can be completely transformative for some people.
Absolutely. There's a book came out a few years ago, Light on Schizophrenia, Dr. Abraham Hoffer's work. And I wrote the introduction and the chapter on celiac. So it's his writings over 50 years. He was a mentor of mine, a brilliant psychiatrist who, again, in the 50s and 60s, was the first one to start thinking there's something biological. But that book has a very nice collection of interventions for schizophrenia.
What are your thoughts on the keto diet? That's been in the news a lot. I know there's a lot of research funded by the Basinski Institute, and there's been studies coming out of Stanford. What have you been seeing in your clinical practice and maybe from your colleagues with respect to ketogenic diet?
Yeah, no, a really important question. I'm glad you asked because, I've been teaching keto and respectful of ketogenic diets in mental health probably 5 or 6 years now. We had our first conference, and I think it's an incredible tool in our toolbox for some individuals. A lot of the consults I've been doing in the past few months, though, are people that have failed the keto diet or gotten worse on the keto diet. So, my only concern is that people see it as the answer to all of mental health problems. I just think it is a profound intervention. It is challenging for adolescents and many adults to sustain a ketogenic diet, but it can be helpful. And just like everything else, whether it's ketamine or other supplements or other drugs, people get carried away as there's one answer to problems with the brain, and we're just never going to get there. So I'm a believer. We teach. I help people understand it. It can be a helpful tool, but if you just look at the diet as the only intervention, oftentimes other things are missed, and that's what I've been seeing in my practice.
Another big topic that's been going on, that's been in the news a lot over the last few years, is psychedelic assisted psychotherapy in psychiatry. What are your thoughts about that?
Well, similar to everything that's coming out now. A great tool, that we can use in our toolbox is getting a little kind of put in this kind of silver bullet path, and that it can cure everything. So I do think there's likely a role for psychedelics in trauma and complex trauma, maybe even addiction. But I gave a talk at a psychedelic conference and just gave some cases of people just using psychedelics, not getting better. And when I saw them, they had what we discussed earlier, B12 of 120. So I just would want someone to have this kind of optimal functional medicine workup before psychedelic interventions. Again, everything just works better if that foundation is laid.
I don't know if you feel the same way, but for Lithium Orotate, that really knocked my socks off and kind of blew me away. What other things have you come across during your career when you've looked at these interventions and it's just been dramatic, or other treatments which are may not be as well known as others? What comes to mind to you?
Well, there are a few things. I'll give you a list of things that I might call nutraceuticals that might be helpful regardless of testing. And lithium would be number one. I've been using what we call the OPCs, these phytochemicals in grapeseed and blueberry and pine bark for mood, attention, for many years, 30 years, is one of the first supplements. So the OPCs, the lithium, a supplement called inositol, very inexpensive B vitamin for anxiety and OCD, and then probably put NAC, N-acetylcysteine, as just an incredible adjunct to treatment. And so those are kind of in that can be incredibly helpful field. And then the rest of most of my world is looking for that individual with that vitamin D level of under 10 and supplementing with vitamin D or the B12 of 200, or as you described it, a gut problem with overgrowth of yeast or Clostridia and treating that. So, we've seen these miracle supplements that are over the counter, simple, if that's the problem. I think my concern nowadays is people are, just reading about a supplement and everyone runs out and takes, vitamin D or B12 or this, that, and the other, again, without the testing. And there's no harm typically, but it doesn't always get at the root cause.
I'm going to pick up on something that you said there. You used the term nutraceutical a moment ago. What is a nutraceutical?
I don't know where I heard that term years ago, but I like it. It's a nutrient that has a pharmaceutical effect. So, like N-acetylcysteine we've used for a number of psychiatric illnesses. It's a micronutrient that has a pretty significant effect. It doesn't treat a deficiency. And the same with lithium and inositol and these phytochemicals.
Magnesium as well is probably would you consider magnesium one of these minerals that can have a calming effect on some people?
Yeah, absolutely. Yeah, there's a deficiency that we would supplement with, and then taking additional magnesium would improve sleep and absolutely decrease anxiety.
What are your thoughts on the biohacking movement? I don't know if you've thought much about it, but it's big out there. There's people who build big Excel spreadsheets of minerals and like barks from around the world and different things, and it's essentially kind of sounds like that. These nutraceuticals, like there's all of these supplements out there and extracts, and people are noticing that when they take them, they feel a little giddy, or they feel less anxious, or they feel a little bit more social. It's almost like kind of having your own sort of psychiatric like pharmacy, of all of these different supplements. There's people who have entire businesses around this stuff. What are your thoughts on this? And they call it biohacking, and sometimes they do like microdosing in there, but it seems to be very big at the moment.
Yeah, I'm not familiar with the details. Certainly, hearing and reading. I think our phytochemicals have profound effects, and we've used them from, again, the grapeseed to curcumin, and then some of these newer ones. It's sometimes hard to sort out what's marketing from companies and what's real. So I just don't have experience with enough of these to know. and there's little research. But certainly some of the phytochemicals in our environment have profound effects on our brain and can affect mental health. Again, I just caution someone struggling with a mental illness to start reading or listening to social media and experimenting. But certainly, healthy adults can try and see what they notice.
Yeah. I mean, a really one that's been around for ages is St. John's Wort. I remember my dad used to take St. John's Wort if he was feeling blue, and I think that's been a really common. I guess, is that a phytochemical because it comes from a plant, that's an
herb with actually great research. And when I started my practice 30 years ago, I used St. John's Wort a lot more than I do now, because it sort of has the same kind of path as a medication. It's symptomatic based, but it is an herb. But now when I've focused on the root cause and the testing, I just don't need as much of that St. John's Wort.
So, Dr. Greenblatt, where would someone go? We have most of our audience is in the US, and they may be wanting to find someone like you who has a similar training. Where would you direct them to go to find someone who could do this type of root cause evaluation with them?
Sure. On our website, psychiatryredefined.org, under the resource section, there are hundreds of docs that have trained with us and that are licensed in different states. So that's probably the simplest path. And I would encourage people to sign up for the newsletter there, because we have a lot of free content, and then new clinicians and new practices have reached out to us. So we'll be kind of providing people with much more access, or try to get the access to clinicians in their states to be able to continue this work.
Yeah. Could you speak briefly about your Psychiatry Redefined Fellowship? Because we do have medical students, residents, clinicians who listen into this, who I think would very much be interested in that. Could you talk briefly about that?
Sure. So in Psychiatry Redefined, we have 2 fellowships, one in general psychiatry, one in child. And these were developed just as because too many of my colleagues would go to a conference, would read a book, and then they're sitting across from a patient and found it challenging to know, well, how much magnesium, what time of day, what's the side effects, how does it interact with the medicine? So we felt that we needed to provide information to clinicians. We have nurse practitioners and naturopaths and psychiatrists and family docs, information that'll be practical and that can be used in a clinical setting, not just intellectual research. So that's how we started. It's a year-long program. And we also developed a number of short programs, like 1-month programs on ADHD and depression, on hormones. So we offer an entry as well as a more immersive training program on integrative and functional medicine.
Yeah. And correct me if I'm wrong, but along with the trainings that you offer, there's excellent pre-recorded and also live content. That it's also supervision. So the people who do that year-long fellowship can come and ask you and your team questions periodically about cases to get feedback.
Yeah, I think that's been the most helpful, because again, the information just sits there if you go to a conference. So there's 4 times a month where there's interaction with the faculty in small groups and larger groups. So you can get your cases discussed and the questions answered.
Okay. So before we wrap up for the day, is there anything that I haven't asked you or about which you want to share, or perhaps a message that you'd have for the audience?
Well, I think, in addition to my professional platform, we are developing now consumer educational materials so patients can have this information. So there's a website, The Mind Refined, which is, we currently have courses on ADHD for parents and anorexia nervosa. our most life-threatening illness in the field of psychiatry. So those are courses for patients and consumers. And then the only other bit is for those in need of residential treatment, I did start working for a residential treatment program in Texas, where if individuals need longer-term 30-day help, whether it's coming off medications or a functional treatment approach, that will be coming up in the next couple of weeks.
Are you able to share the name of the place? Because I know some people will hear this and, well, this will be out way past 2 weeks, probably in a couple of months, and they're going to want to Google it. So how will they find it?
Yeah, it's called Enter Health in Texas. So it's outside of Dallas. It's a beautiful residential setting. They've 18 years focused on addiction and psych, and we are developing a functional psychiatry program. So we will have the testing in addition to all of our other treatment modalities, including therapy and TMS and pharmacology if needed. But it's an opportunity for those patients that have struggled to provide a functional psychiatric treatment model in a residential setting. So I'm very excited about being part of that endeavor.
Dr. James Greenblatt, thank you so much for taking the time from your Saturday morning to come and speak with me and my audience.
No, I appreciate the invitation, and the work that you're doing is incredible, and please keep it up and keep in touch.
If you're a clinician and you want to learn more about safely getting your patients off psychiatric medications, be sure to check out this video here where we give away our entire drug tapering framework.